I'll share my screen. Okay, you guys see that so far?
Yes.
Okay, perfect. And as we do this, if you guys have any questions, just feel free to ask. Okay, I should be able to join here. Perfect, we'll get started. Okay, cerebral and endocrine dysfunction. Remember back to week 7. Okay, growth hormone is administered by what route? Sub-Q injection, orally, IV, or intramuscular? Subcutaneous, okay? So just under the skin, not into the muscle for growth hormone. So just like with insulin, okay? Good. All right, highest priority for a patient diagnosed with syndrome of inappropriate antidiuretic hormone, or SIADH. Decreased deep tendon reflex, increased temp, EKG changes, or INO. What's your highest priority assessment? INO. Okay, remember, because that's they're not diuresing, so they're holding on to the fluid. Okay, so they're not urinating like they should be. So it's really important to keep an eye on their intake and output. Okay, good. Okay, which is following are signs of SIADH, or syndrome of inappropriate antidiuretic hormone? Decreased urinary output, decreased urinary specific gravity, increased urinary glucose, or increased urinary output? Yes, good. Decreased urinary output. They are not urinating like they should be. Good. What is important to cover when teaching the family about PTU? It's used for hypothyroidism, can cause leukopenia, which places them at more risk for fever and sore throat, can increase your blood sugars, or you take it at bedtime. Yes. So PTU, it is a medication that decreases your white blood cells. Okay. So that's what leukopenia means, decreased penia. And then leuko is for your white cells. Okay. So that puts them at higher risk for fever and infections. So they had a fever and a sore throat, you would be concerned. Okay. Good. Okay, multiple select. An initial sign of diabetes insipidus is polyphagia, polydipsia, polyuria, hyperglycemia. Okay, this is kind of a tricky one. So remember, diabetes insipidus is not diabetes, like type 2 or type 1 diabetes symptoms. Okay, so their blood sugar isn't going to have any effect in diabetes insipidus. This is purely fluid driven. Okay, so they're going to be having increased urination and increased thirst. Okay, those are the first signs you're going to see. Good. Okay, another multiple select. What are the clinical manifestations for juvenile hypothyroidism? Dry skin and sparse hair, constipation, weight loss, decreased growth. Pediatric hypothyroidism. What signs are you going to see? Yes, good. Dry skin, sparse hair, constipation, decreased growth. Why wouldn't you see weight loss?
You see weight loss and hyperthyroidism, right?
Right. So you'd see weight gain, right? And hypothyroidism or hypothyroidism. Yep. Weight loss is in hyperthyroidism. Good. Okay, the child had a simple febrile seizure. What education would you provide to the parents? Proper usage of anti-epileptic medications, education regarding epilepsy, safety precautions to take if another febrile seizure occurs, long-term deficits associated with simple febrile seizures. Yes, good. So safety precautions to take if they have another febrile seizure. Not super duper likely, but about a 20 to 25% chance that they have another febrile seizure if they've had one previously. Usually with an illness. So just kind of let them know if their kiddo has a fever in the future with an illness that it should be treated with Tylenol or Motrin. Okay, what type of seizure is when your body is jerking, you're foaming at the mouth, and the child is rendered unconscious? Absent seizure, atonic seizure, tonic-clonic. Yep, good. Or this should say pseudo seizure instead of psychoseizure. Good. Okay, what notable sign may indicate increased intracranial pressure in an infant? Overflow voiding, bulging fontanelle with crying, high-pitched crying. Yep, good. Minimal lower extremity movement. Hi, Ashley. You can join us. You should be able to join the Kahoot. The pin is at the bottom. So I'll give you a second for that. Ashley Sellers, can you hear me?
Yes, it's loading.
Okay, perfect. I just wanted to make sure you could join us before I go to the next question. Are you ready?
Yeah, you can go ahead.
Perfect. I know sometimes it takes a while. All of the following increase intracranial pressure except fluid overload, coughing, tachycardia, suctioning. Okay, tachycardia. So fluid overload, you're going to have more fluid in your in your cranium, in your intracranial spaces and all of that, because you're having more fluid all throughout your body. So that's going to increase your intracranial pressure. Coughing, the pressure of coughing, that also increases your intracranial pressure. Same with suctioning. Okay. So the only thing that truly does not increase cranial pressure is high heart rate tachycardia. Okay. Good. All right. What findings can alert you that head injury has gotten worse? Decreased restlessness, change in orientation, headache improving, or easy to arouse? change in orientation. Okay, so if there's any change in orientation, they were awake, they were alert, talking with you, and then all of a sudden, they're not responding to pain or they're totally confused. That would be concerning, especially if you already know that they've had a head injury. Okay, multiple select. What does it mean when you see fixed and dilated pupils after a head injury? The brain is compensating for the swelling. If the pupils remain fixed for longer than 5 minutes, it means brainstem damage. This is a neurological emergency. The brain is responding. Good. So, if the pupils are fixed for longer than 5 minutes, then you're very much concerned about brainstem damage. And then it's a medical emergency. Okay. So they need to see a neurologist right away. See if they can intervene. Good. What medication may be used for a child with cerebral edema due to a fall? Furosemide, phenobarbital, mannitol, phenytoin. Good. Yes, mannitol. Okay, febrile seizures usually occur in patients younger than 3 months, patients between 6 months and 6 years, teenagers between 13 and 18. Yep, good. Patients between 6 months of age and 6 years of age. Good. Childhood hypopituitarism results in what condition? Gigantism, pituitary dwarfism, acne, or achondric dysplasia dwarfism? Yep, pituitary dwarfism. Good. Okay, how would you describe precocious puberty? Reaching puberty early, breast development at age 6, starting menstruation at age 7, growth of bones and muscle. Yep, good. Early puberty. Okay, multiple select. What lab values are important to monitor with a child with congenital hypothyroidism? Thyroxine, growth hormones, TSH, cortisol. T4 or thyroxine and TSH. You don't really worry about growth hormones with these kids unless there's some sort of other defect going on. Okay. And you don't worry about checking cortisol levels either. Okay, good. How can you monitor a child with hypo or hyperthyroidism? Record their height and weight, strict measuring of weight monthly, measuring performance at school, monitoring food intake. Yes, their growth, height and weight. Good. Which acid-base alteration would you see in a diabetic child with Kussmaul's respirations? Respiratory acidosis, metabolic acidosis, respiratory alkalosis, metabolic alkalosis. Good. Yes. They're breathing out CO2. Okay. So they're becoming more alkalotic. Okay. Good. Multiple select. What would a child with Cushing's syndrome look like? Moon face, red ruddy cheeks, more than usual hair growth, fat in the trunk and face. Yep, all of those things. So they're going to have that facial swelling where they look just really puffy, red, ruddy cheeks, and then more than usual hair growth. They're also going to have a lot of truncal obesity. Okay. Which drugs are used for nocturnal enuresis? Desmopressin and vasopressin, terazosin and prazosin, Diamox and Vagamox. Okay, good. Yep, desmopressin and vasopressin is what's used for nocturnal enuresis. Good. That's pretty much a GU question in my opinion, but which information will the nurse include when teaching a patient about thyroid replacement therapy? Take the medication before bed. You will experience beneficial effects from this drug about 1 week after treatment. Stop taking the drug if you experience insomnia. Take the medication in the morning on an empty stomach. Yes, take it in the morning on an empty stomach. Okay, that's how it will work best. Okay, another multiple select. You walk into a child's room, they have a fever of 104.6, you see them having a seizure, what can you do? Check the bed for objects that may hurt them, put the side rails up and pad them if possible. Turn the child on their side, give them a cold water bed bath. Yes, good. Perfect. All your seizure safety things. Never give them a cold water bath if somebody has a fever, because that's actually going to worsen their situation, especially if they're already having seizures. Okay, an autoimmune disease of the thyroid gland. Goiter, Hashimoto's disease, thyroiditis, parathyroidism. So Hashimoto's disease is your autoimmune type of disease with the thyroid gland. You'll also see it called Hashimoto's thyroiditis. Okay. Addison's disease is decreased secretion of cortisol, decreased secretion of cortisol and aldosterone, increased secretion of cortisol, increased secretion of cortisol and aldosterone. Yes, decreased secretion of both cortisol and aldosterone. That's Addison's. Okay, good. Multiple select. VP shunt, ventriculoperitoneal shunt, is used with hydrocephalus. Do not bump the shunt. Used in epidural hemorrhage. Measure head circumference every shift. There are some things you're going to do with the kid with a VP shunt. Yep, good. It's used for hydrocephalus. You don't bump the shunt or pump it. And then you want to keep an eye on your head circumference measurements. If they're increasing, what would that mean?
Increased intracranial pressure.
Uh-huh. So why would that happen if a kiddo has a VP shunt? You shouldn't see that, right?
Maybe there's like a leak or it got displaced.
Or yeah, a blockage. Yep, good. Perfect. Okay, a common sign of Graves' disease includes blank or protrusion of the eyes, exophthalmos, expertosis, ophthalmia. Yep, exophthalmos. Okay, good. Okay, multiple select. What are signs of hyperparathyroidism? Nausea, vomiting, paresthesias in the extremities, confusion, or hypocalcemia? Yes, good. So nausea and vomiting, paresthesia, or that pins and needles kind of feeling in the extremities, and confusion. What would you see the calcium do? The calcium level.
Go up.
Yes, it would be elevated in hyperparathyroidism. Good. What does parathyroid hormone do? Regulation of calcium levels in the blood, regulates urinary output, growth hormone, or sex assignment. Yes, regulates your calcium levels. Good. Okay, multiple select. Hypoparathyroidism has the symptoms of tenic, muscle contraction, and muscle weakness, elevated vitamin D levels, tetany, low calcium levels. Yes, good. So muscle weakness, you're going to see tetany, which is that muscle tightening. Okay, it's not going to respond if it's stimulated. And then also low calcium levels because it's hypoparathyroidism. That's your Chotsky sign, like where you're hitting their cheek and then they're having twitching. Okay, which of the following might be caused by an adrenal crisis or Addisonian crisis? Fluid overload, abrupt withdrawal from steroids, hyperglycemia, or extreme hypertension? Yes, abruptly stopping steroids can cause adrenal crisis. Okay, that's why they always tell you to wean them if it's longer than 7 to 10 days. Good. Okay, another multiple select. Cardinal sign of diabetes insipidus. Polyphagia, polyuria, polydipsia, decreased urinary output. Yes, good. Polyuria and polydipsia. Another multiple select. Congenital adrenal hypoplasia. Parent teaching should include the child is infertile. They require gender assignment, cortisol and aldosterone replacements, and no genetic testing is needed. Yes, good. The child is infertile. They require gender assignment, and then they'll have lifelong cortisol and aldosterone replacements. Okay. And they will have genetic testing completed. Good. What causes type 1 diabetes? Destruction of the beta cells by the autoimmune process, too much candy, progressive disorder with a combination of insulin resistance, impaired fasting glucose, or impaired glucose tolerance. Yes, destruction of the beta cells. Okay. And it is an autoimmune disease. Which statement about phagocytoma is correct? It is usually malignant. It's a catecholamine producing tumor. It's only found in the adrenal medulla, and it is normally manifested by hypotension. Yes, it's a catecholamine producing tumor. Okay, so you're going to see all those catecholamines increase if someone has pheocytochromoma. Okay, multiple select. Which action should the nurse implement in the care of the patient with pheocytochromoma? Monitoring glucosuria, monitoring for elevated heart rate, monitoring for hypertension, monitoring for sudden weight gain. Yes, monitoring for hypertension and elevated heart rate because of your catecholamines increasing. That's going to increase your heart rate and increase your risk for hypertension. So if that would start happening, then you would get really concerned that that tumor is causing more issues for that patient. Good. Okay, multiple select. Nursing care of the unconscious child includes neuroscience Q every 2 hours, pain control, vital signs with temperature every 2 to 4 hours, or monitoring strict INO. Yes. Neuroscience, neurochecks every 2 hours, vital signs, and monitoring INO. Okay. Good. What might you suspect if a child feels jittery, sweating, and is dizzy? Child is having a seizure, the child is in pain, hypoglycemia, or the child has a fever. Yes, good. Hypoglycemia. So jittery, sweating, and dizzy. Good. Symptoms of diabetic ketoacidosis or DKA are fruity breath, excessive hyperglycemia, ketonuria, or all of the above. Okay, what happened here? We got distracted.
Yeah, I didn't. I thought it was select all that apply first.
Yep. So make sure on your exam questions, you guys are reading the whole question and all of the answer options before you select. Okay, so all of those things. High blood glucose, so excessive hyperglycemia, and ketonuria, so spilling ketones in the urine. Those are all going to be symptoms that you see with DKA. Good. Okay, multiple select. An adolescent with a BMI above 95th percentile has been urinating a lot. What test can you anticipate? Urinalysis, pregnancy test, hemoglobin A1C, electrolytes. Yes, good. So urinalysis and hemoglobin A1C. Electrolytes, you could potentially check those to make sure. I mean, that's a little quicker way sometimes to check their glucose, but an A1C is going to be more accurate because if they're not fasting, their glucose can be all over the place depending on what they ate. So the A1C is more accurate. And that looks at their average blood sugar over how many months? Do you guys remember?
3.
3 months. Yep, exactly. Good. Okay, DKA is caused by a lack of insulin leading to the use of other fuels for energy, overdose of insulin leading to the release of ketones. Ketones are poisonous chemicals which can build up. Most common type of type 1 diabetes. Yes, lack of insulin leading to the use of other fuels for energy. Okay, that's why you see DKA happening. Good. Multiple select. Child is admitted with a blood sugar greater than 600 and large ketones in their urine. What's your priority intervention? Give regular insulin sub-Q, IV fluid bolus, titrate regular insulin drip, or replace electrolytes. Okay, so you're going to do a fluid bolus of normal saline, and you're going to start a titrate insulin drip. If their blood sugar is over 600 and they're having large ketones, they're already in DKA. So doing sub-Q insulin isn't going to be as beneficial as starting an insulin drip. Okay, good. A diabetic child complains of feeling jittery. Their blood sugar is 45. What is the best treatment for the child? No log insulin, drink a cup of orange juice, have the child rest, decrease the next insulin dose. Yes, drink some orange juice. Good. And if, let's say that that child didn't communicate with you and they're out of it and they don't seem like they'll drink anything or eat anything, what could you do?
What? Say that again?
So if the child wasn't complaining of feeling jittery, so they're not with it, and you start to note, you check their blood sugar and it's low, what is something that you could give them if they're unable to eat or drink?
The glucagon
Yep.
IM.
Yep. Good. Your patient has experienced a head injury. What would most concern you? No BM in 3 days, decrease urinary output, dry skin on lower extremities, a heart rate of 88. Decrease urinary output. Why would that be most concerning?
They could be going into shock.
Yes, potentially, but they had a head injury, right?
Yeah, so it's maybe increased
And
intracranial pressure.
Yep, because they're holding on to that fluid and they're not urinating appropriately. Yep, exactly. Good. Okay, multiple select. How do you detect diabetic ketoacidosis? Child has elevated blood sugars, ketones present in the urine, dehydration, 4 plus glucose in the urine. Yes, good. Elevated blood sugars, ketones in the urine, and 4 plus glucose. Now, they're not always dehydrated, but as they continue to have DKA that's not addressed, they're going to be more at risk for dehydration. Okay, so dehydration isn't automatically a sign of DKA, but the other 3 are. Okay. Multiple select. What would alert you that a child's head injury is deteriorating? The child becomes confused, difficult to arouse, child is becoming restless, or they're complaining of headache worsening. Yes, good. Any of those things happening. Good. Okay, the primary cause of injury associated with submersion: pneumonia, hyperthermia, increased ICP, or hypoxia. Yep, good. Hypoxia. Child has been diagnosed with bacterial meningitis. What's your nursing priority? Strict INO, administering antibiotics as ordered, elevating the head of bed at 30 degrees only, Administering pain meds. Yep, good. They're going to get antibiotics. IV right away. Okay. Good. To identify whether the cause of meningitis is viral or bacterial, they will obtain a what? CT scan, fast strep test, spinal tap, MMR. Yep, spinal tap. Good. Okay, double points on this one. Precautions for bacterial meningitis. Airborne, contact, droplet, reverse isolation. Droplet precautions, okay, for bacterial meningitis. So mask. Okay, good. Perfect. Which medication is used for those with increased intracranial pressure to rapidly reduce the pressure? Furosemide, spironolactone, Lasix, mannitol. Mannitol, okay. Lasix, furosemide, spironolactone, those are all diuretics, right? Or forms of diuretics, but mannitol is going to be the one that reduces your pressure and it can cross the blood-brain barrier more quickly. So that's why that works. Traumatic brain injury is physical damage to the skull due to the head. The brain is shaken, loose, and needs to reattach itself. Damage to the brain due to sudden force to the head. Physical damage of the nervous system due to medication. Yes, damage to the brain because of a sudden force to the head. Good. Okay, multiple select. Symptoms of traumatic brain injury of an infant. Bulging fontanelle, distended scalp veins, tachycardia, bradycardia. What are you going to see with infants for traumatic brain injury? Yes. Okay, so this one's kind of tricky to figure out if you're going to see tachycardia or if you're going to see bradycardia. So you're going to see bradycardia in the case of traumatic brain injury in an infant. Okay. Also distended scalp veins and bulging fontanelle. All of those are signs of increasing intracranial pressure from a TBI. Okay. They're also going to be super fussy or totally out of it. Okay, last question here, a multiple select. Which CSF labs results correlate with bacterial meningitis diagnosis? Decreased red blood cells, elevated protein, low glucose, decreased white blood cells. Okay, so you're going to see elevated protein and a low glucose. So it's not decreased white blood cells, it's increased, right? Because it's bacterial. Okay.
Yeah, it's increase.
So that's your distinguishing factor. Okay, you're going to see increased white blood cells in that cerebral spinal fluid. It's also going to be cloudy appearing usually. Good. Perfect. All righty. So would you guys like to, okay, hang on. Do you want to do week?
Can we do this week 9 or whatever?
Yep. Okay, perfect. Sounds like a plan to me. Get this going and then I'll share the page. share my page again here. Okay, you guys see that again?
Yep.
Perfect, thank you. Perfect. Okay, musculoskeletal and neuromuscular dysfunction. Okay, multiple select. What is the priority for a nurse to assess following a cast application? Pulses, movement, pain, sensation. Yep, good, perfect, all of those things. Good. Okay, another multiple select. Patient teaching for a child with a fractured bone that has a new cast applied. Use cool air dryer for itching. Use a hanger to itch inside the cast. Do not use powder or lotion in the cast. Child may swim with the cast once it has dried. Yes, so you can use a cool hair dryer for itching. Like they can just blow it kind of up into their cast, but it has to be on cool. Okay, and then no powder, no lotion of any kind into the under the side of the cast. Okay, good. What should the nurse monitor after a soft tissue injury? Vital signs frequently, neuromuscular checks as ordered, oxygen levels if ordered, I's and O's. Yes, neurovascular checks. Good. A fracture that penetrates the skin is called what? Simple, green stick, compound, buckle fracture. Yes, compound fracture. That's penetrating through the skin. Okay, good. Multiple select. Bryant's traction. Used for a child less than 30 pounds. Hips are elevated and legs are at a right angle. Skin traction for developmental dislocated hip, or check the skin for breakdown. Yes, good. All of those things. So Bryant's traction is utilized for hip dysplasia, so developmental dislocated hip. Okay, good. What is the priority nursing care for a child with a compound fracture? IV antibiotics, neurovascular checks, pain medication, hydration. What's your priority? IV antibiotics. Yep, good. Because they have that compound fracture. That bone is exposed and everything internal is exposed to potential infections. Perfect. Okay, what is your priority nursing care for a child who fell off a second floor balcony? Monitor vital signs, neuro checks, strict immobilization of the spine, monitor I and O. Yep, immobilize them. Good. How would you immobilize them?
You put the collar on their
Seat
neck.
collar. Mm-hmm. Yep, good. And a backboard too.
Yeah.
Yep, good. Okay, principles of managing soft tissue injury include ACE wrap and take to a physician, rest, ice, compression, elevate and place a heat pack, ice bags, and Tylenol. It should say acetaminophen. Rest, ice, compression, elevate. Yep, good. Okay, epiphyseal plate fracture in children may repair very rapidly, disrupt growth of the bones, only happen during infancy, do not develop until adolescence. Yes, good. Epiphyseal plate fractures, so that's the growth plate. So if they have fractures through those or on those areas, then a lot of times you'll see the growth of that bone is disrupted. So they're not going to grow as well with just that extremity. What finding for a patient in skeletal traction indicates peripheral neurovascular disruption? Abnormal mobility, absent peripheral pulse, localized tenderness, muscle spasms. Yes, good. An absent peripheral pulse. Good. Okay, multiple select. How should the nurse care for skeletal traction for a child with a fractured femur? Document the weight of the traction every shift. Remove weights for AM care only. Reduce weights daily by a half pound. Make sure the weights hang freely with no obstruction. Yes, good. So document the weight that's on the traction every shift at least. Okay, make sure that the weight is hanging freely without any obstructions. Good. When caring for a child, a 9-year-old child in Buck's traction, what action by the nurse is correct? Encourages 3-year-old sibling to sit on the bed and visit. Helps the child learn how to raise and lower head of bed. Checks capillary refill on extremities every 4 hours. Teaches mom to place weights on bedside table. Yes, checking that cap refill. Good. What position do you put your legs in for an infant with hip dysplasia? Adduction, abduction, internal rotation, or knees straight? Abduction. So think adduction is bringing it closer to the body, and abduction is further. Okay. So you're adding to the midline. So bring it to the midline. Okay. But with hip dysplasia, you put them in abduction. Good. What statement by parents indicate more teaching regarding their 2-year-old infant with clubfoot? Treatment needs to be started as soon as possible. I realize my infant will require follow-up care until grown. I need to bring my baby to the clinic 1 month for a new cast. I need to come to the clinic every week with the baby for casting. Yes. Bringing the baby in about every month before they do a new set of casting for them. So these kids are going to get serial casts about a month apart. Good. Multiple select. Osteogenesis imperfecta. Child abuse, brittle bones, bone decomposition, or inability to form type 1 collagen. Long bones are crooked. Aggressive physical therapy. Yes, brittle bones and bone decomposition and long bones are then going to be crooked appearing, okay? Aggressive physical therapy will cause potentially more fractures, so that would not be advised in this situation. And of course, if a kid shows up with multiple fractures, you have to be concerned about child abuse, but osteogenesis imperfecta is a reason why kids might have multiple fractures that are identified on an x-ray. So of course, if it's known that they have osteogenesis imperfecta, you're going to be less suspicious for child abuse. Okay. Okay. What is a pathologic cause of Ley-Kath-Pertz disease? Slipped femoral capital epiphysis, ischemic aseptic necrosis of the femoral head, hematogenesis, dissemination of infection, or hereditary and environmental factors. Excuse me. Yes, ischemic and aseptic necrosis of the femoral head. So you can actually see in this X-ray here. I'll show you. So here is how a normal kiddo's hip should look. Here's your growth plate. Okay, so it looks like that could be a fracture, but that's just the growth plate. And then here is Ley-Kath-Pertz. So here's all the small necrotic area to the bone. You don't have a really good identifier there. And there's also kind of a little necrosis there as well. But right here at the femoral head is where you're really looking. Okay, good. Okay, kyphosis. Sideways, humpback, swayback, normal. What is kyphosis? Humpback. So that kind of hunch in their back, like at the base of the neck. Okay, so that's kyphosis. Basically, all of us are getting kyphosis because we're all hunched over our computers or our phones or watching TV with poor posture. Okay, multiple select. Which assessment indicates an infant has developmental dysplasia of the hip? Positive moral reflex, positive Ortolani's sign, asymmetrical leg folds, or positive Babinski's reflex? Yes, positive Ortolani sign and asymmetrical leg fold. So if those leg folds aren't matching up exactly the same when you're looking at their legs, then you would be concerned about hip dysplasia. Okay, and then Ortolani and Barlow's signs. If either of those are positive, then you get concerned about hip dysplasia as well. Good. Lordosis is described as what? Lateral curvature of the spine, exaggerated forward rounding of the back or hunchback, inward curve of the lumbar spine, normal spinal curvature. Yes, exaggerated, I would add inward curve of the lumbar portion of the spine. Good. Good. All right, scoliosis is excessive backward or outward curvature of the upper portion of the spine, condition where the spine is visibly curved to the side in an S shape, excessive forward or inward curving of the lower back. Yes, good. So that's going to be the S shape kind of curve to the spine. Okay. And a lot of times it's, throughout their whole spine that's curved. Good. Adolescents with scoliosis that have up to a 45-degree curve of the spine would need to lose weight, have surgery for correction, wear a brace for 23 hours a day, and decreased activities. Yes, they're going to have to wear that brace 23 hours a day. So up to 45-degree curvature, no need for surgery. If it continues worsening, then they're going to have surgery. So if it's over 45-degree curve, so if they're at like 48, 49, 50, then they're going to have surgery for correction. Good. multiple select. Teaching for a child with scoliosis with less than a 40-degree curve. Wear a brace 23 hours a day. Do not apply lotion under the brace. Wear a cotton shirt under the brace. Follow physical therapy exercises. Perfect. All of those things, okay? So making sure that they have a shirt under the brace so the brace isn't, cutting or rubbing on their skin. Don't put any lotion under the brace because that puts them at more risk for skin breakdown. They need to have the brace on for 23 hours out of 24 hours a day. And then they need to be doing physical therapy exercises. Good. Multiple select. Pavlok harness is used for infants with developmental hip dysplasia. Okay. Check under the brace. Holds the hips in abduction for proper positioning. Massage the area when the brace is removed for 1 hour during the day. Yes, all of those things. Okay. Pavlok harness, same thing like with your brace for scoliosis. It's going to be 23 out of the 24 hours a day. Okay. So they can take it off during baths. Massaging that area kind of will help with any cramping or discomfort that they might be having. Okay. Good. Looking for any skin breakdown, things like that. Okay. What is osteomyelitis? The process of which the bone remodels, an inflammatory condition of the bone caused by infection, inflammation of the periosteum, or an inflammation where the tendon joins the bone. Yes, good. An inflammatory condition of the bone caused by infection. Good. Goals for juvenile idiopathic arthritis include reduce joint pain and swelling, emotional health, promote dependent functioning, promote immobility. What's the goal with JIA? Yes, reduce pain and swelling. Good. Okay, we'll do one more question here, okay? Okay, another multiple select. What might you anticipate for a child diagnosed with JIA? Joint disfigurement, uveitis, difficulty walking, facial rash. Yes. So facial rash is a no. Why would you not see, or what condition do you see facial rash with? Not JIA.
Is it rheumatoid arthritis?
You can see that. Yep. And lupus. Okay. Good. Perfect. Alrighty. Any other questions or concerns?
No. I think so.
No?
Thank you.
Yep. Thank you. Have a good rest of your guys' day. Let me know if you need anything else.
Thank
Bye.
you.
Yep. Bye.